All right. Well, welcome back to Ultrasound Grand Rounds this week. Pretty excited. We are wrapping up the academic year with just this week and a couple more lectures. We're going to change gears a little bit today. Got Dr. Sandy Werner back in the studio, and we're going to talk a little bit about how to give a presentation. You know, we spent a lot of time over the course of the year talking about the ins and outs of how to do ultrasound and how to interpret it and what it means for our patients. But part of what we do here at Metro is we teach people not just how to do ultrasound, but how to teach ultrasound, right? We teach our residents, we teach our fellows how to be a good ultrasound faculty. And one of the important aspects of ultrasound, being an ultrasound faculty, is teaching. And so it's helpful for us to understand how to put together a good, effective presentation so that we can communicate all the helpful knowledge that we have to those who are our learners. And so I'm pretty excited to welcome back Sandy to the forum today for a little bit of a lecture about how to teach. And I think this one's going to really get you hungry for more knowledge and hungry for more skills at teaching. And so without any further delay, I'm going to turn things over to Dr. Sandy Werner and look forward to your presentation about how to give a presentation.
All right. Thanks, Matt. Okay. So yeah, we are going to be a little divergent today. And actually, we're going to talk about how to make the most of your ultrasound lecture. And really, it's as easy as pie. And Matt was a little unhappy that I didn't bring a pie with me today. So we're going to have to fix that. So that's where we're going today. And really, this can be applied to any topic. But I've made it sort of ultrasound oriented for the Grand Rounds series. So I have no disclosures. I have no conflict of interest. And there's the objectives because I have to have this slide in there. But here's what we're really going to talk about. We're going to talk about coming up with the core concept, that one, what is it you want people to come out of this lecture with. And, today it's going to be making the perfect pie and presenting it. We're going to talk about the key ingredients, the objectives, and how to decide what they are and how many you should have, and also what the proportions are. What kind of pie are you making? We're going to talk about putting it all together, which would be assembling the pie, basically the recipe or preparing your presentation. And we're going to talk about the baking of the pie, which is where you're going to be doing a lot of work on a lecture before you present it and after you've put it together. And then we're going to talk about presentation. And I do apologize if people are starving to death, but go get a piece of pie or something else. All right. So the core concept, and this is really fundamental. It's basically, what do you want people to come out of your lecture with? Do you want them to be able to identify an ectopic pregnancy based on reading somebody else's ultrasound? Do you want them to be able to perform a FAST exam? Would you like them to be able to explain Doppler ultrasound to another student? So you want to come up with your core concept. What is it that folks need to get out of the lecture? And then, of course, your objectives will develop from that. So my core concept is making the pie and presenting the pie. So typically, a maximum of 5 objectives. I was at a lecture recently and there were 13 objectives, and I'm pretty sure I retained none of it. I think I got the core concept though. So maximum of 5 ingredients or five objectives. And then you'll notice that the flour is on a scale because you're going to have to kind of decide the recipe. What are the proportions and how are you going to put it all together? Because there's lots of ways to make a pie. So as I think about the lecture, is my focus going to be the basics, just your basic lattice pie, or am I going to really focus this on the evidence, go deeply into the literature? Am I going to just use some case vignettes to do, we're going to have 5 teaching points. So you have to decide really how your lecture is going to be put together. So proportionalizing and putting your objectives together into the format for the lecture. So, and that's really the recipe, right? So there it is. And then we're going to talk about assembling the pie. So I'm going to put it all together, starting with the basics, starting with the crust. And everybody knows it's much easier to remember something if it's a story, right? If you tell somebody a case and you make it a story, they're going to remember the teaching point. They're going to say, oh man, I remember that. So if you just go through your lecture and you list off a bunch of things and it's all text and you're not really telling a story, your retention level is going to be pretty low. So, and it's always great to use images. So I could tell you the beginning of this story. It's a 55-year-old female. She's in your emergency department. She's sitting in a chair because there's like no beds available and she's short of breath. But I could show you this picture and I could briefly deliver the same thing. And here's this woman and she's in, hall Y. We only have chairs left. At least they're fairly nice chairs. She's on oxygen. She's short of breath. You go over and talk to her because nobody else has even been able to get to her. And, you think, I don't know. She's got heart failure. She's got COPD, which one is this? And, I'm not quite sure. It's going to take a while to get the blood and the x-ray and probably even an EKG. So what could I do to make my diagnosis or to help me out? Gosh, I could use something called the Blue protocol. And so I'm going to walk through that protocol with this patient. So now you've gotten your hook in, you've got a story, and you're going to take it forward throughout your talk. And as you do this, you need to think about who's your audience. Are these people who have never seen an ultrasound transducer in their life? Are you talking to a really experienced group? Like, is this a bunch of fellows or a bunch of your peers that you're teaching? Is it a mixed level audience? And then what's the expectations? Are they coming to this lecture expecting that they'll be completely competent in the FAST exam afterwards, or are they coming thinking that they're going to learn the ins and outs of scanning for an ectopic pregnancy? So what are their expectations? So your learners may be very basic and they need a lot of foundation. So your pie is going to have a lot of crust. So this is the kind of lecture that's going to be the fundamentals, and it's going to be lots of basic stuff, lots of crust. You may have an audience that already has the concepts down, but they're looking for advanced knowledge. And so it's going to be a little bit more complicated of a pie. We're doing some lattice work and that sort of stuff. Or your audience may be really sophisticated and, all they're interested in the pie is the apples and the cinnamon. So we don't need a lot of crust. They already have the foundation down, but they really want to delve into the fine aspects of doing color Doppler. So your pie is going to have to be made up with very little crust and lots of apple, lots of spice. Or worst of all, you could have mixed learners, in which case you're going to need a fair amount of foundation, but also include some of the finer details. And that's a bit more difficult of a lecture to put together. But that's why you kind of want to know who your audience is before you give this lecture so that you can put it together appropriately. And then you have to also think about the venue and the format. Where am I giving this lecture? And is there a specific format that this is in? Is it 40 minutes of lecture and then there's 10 minutes of Q&A? Or is it I'm expected to take questions in the middle? Or are there no questions? So you want to get a sense for that. And then, of course, what's the available technology? So you might be talking in a form that looks like this. So as you can see, there's not a lot of room to walk around. It's a really large audience. You're going to kind of be stuck up front. And in fact, if you take a few steps away from that desk or the podium, you may be in trouble because if you're like me and you wander, you will find yourself falling off of the little the podium area there. So you really want to know what kind of format, what kind of facility you're going to be in. And for those of you who are young, just a point of interest, this is something called a blackboard, and you use chalk to write on it. So, so is it this kind of a forum, or are you speaking at lunchtime where people are going to be eating, and you're going to have to really kind of engage the audience more and walk around amongst them to get their participation and make sure that they're listening to you? Or is this a really casual lecture where you're just doing it for 5 or 6 fellows and you're sitting around the picnic table? So you have to really think about your audience as you put these together. And you can also be in this format, a Zoom format, or a WebEx, or any of those other electronic meetings. And you can see people are sort of tuned in, sort of tuned out. This guy is staring off into the space, and there's probably somebody eating and drinking, and at least these people are on camera. But how to engage this type of an audience, and that's actually a separate lecture in itself, how to make the most of doing a video or a Zoom lecture. But that's a consideration. Or you could be doing a mixed format like we're doing here. So we have people on the Zoom, but we also have people who are just going to watch this later on YouTube. So it's a little hard to be interactive because we may not capture that for the YouTube. And then, of course, what are your time constraints? If I only have 10 minutes to give the interns a lecture on the FAST exam, I know I'm going to have to be super basic. It's I might just have 2 objectives. Or do I have a full hour to do lecture? Or am I supposed to do 45 minutes and then they get 15 minutes for questions? So you really want to think about your time constraints. And then we're going to maximize the slide impact, right? So this is a nice example of using an image to talk about maximizing the slide impact. So you can do an entire list of text, and you'll see this often in lectures where they have this sort of long list. And this is a recipe. I'm getting away from apple pie for a few minutes here because I haven't done any chocolate yet. And for me, I really would rather be eating a chocolate pie. So I can read this to you. Here's your ingredients: pastry for a single crust pie, 3 tablespoons of sugar, 1 tablespoon of cornstarch, 2 cups of fresh unsweetened raspberries, et cetera, and so forth. And you get that. But I could also put this slide up and I could say, okay, here's what we're going to do today. We're going to make this pie. And first, you're going to take a 9-inch regular pie shell. You're going to bake it for about 15 minutes, making sure you prick some holes in it. And then you're going to boil a couple cups of raspberry with some sugar and for about 15 minutes and pour that in the bottom of the crust. And then you're going to let that sit and cool off for a while. Then you're going to make the next layer, which is like cream cheese and whipped cream, and we're going to mix those together. And then it's sugar, whipped cream, cream cheese, little raspberry extract if you have some to give it that nice pink color. And then you're going to spread that layer out on the cooled raspberries. And then we're going to let that sit in the fridge for at least an hour because you want it nice and cold. And then we're going to make that top layer, which is the chocolate. So we're going to melt the chocolate and butter in a pan. And, it says use 2 ounces, but I think 4 ounces is better because I like chocolate. So, and then we're gonna once the ganache is on, we let it sit for a while. We can decorate it with some raspberries, and then we're ready to serve it. And at this point, I just gave you the same information, but it's all done with a picture. So use images when possible. So here's an example. This is actually from a talk I gave a while ago to was like junior faculty, and it was just like to emergency medicine junior faculty, and it was a lecture on how to say yes selectively. So I could have done this. I could have said, wow, there's going to be a lot of academic opportunities for you. There will be academic emergency medicine. There'll be simulations. There'll be residency admin. There'll be residency evaluation. You can get into the CCC. You might want to train medical students, et cetera, and so forth. And each looks really good on its own. But when you put them all together, it's kind of overwhelming. So, and you know what happens when you say yes to everything? It's, your work is unfinished, you're late, et cetera. So it's a bad place to be. So your goal is selective yes. And I could have done that, but it's kind of boring, forgettable, really not exciting. So try this. There's a lot of academic opportunities that you're going to have in your career. And early on, many people are going to offer you different things to do. So, they might offer you simulation education, residency admin. Oh, that sounds like fun. Become an APD. Ooh, that sounds really good. How about doing the student clerkship? How about some clinical education for the residents? Wouldn't you like to do some didactics as well? And how about some community service? And maybe you'd like to be on a hospital committee. Maybe you'd like to be on a CORD committee, which is the Council of Residency Directors for EM. Maybe you'd like to be part of the Emergency Residence EMRA, Emergency Medicine Residency Association. Maybe you want to go to SAEM and be involved with that. There's tons of committees there. Maybe you want to write some book chapters. Maybe you'd like to get involved in QA projects. How about social media? How about podcasts? There's just lots of opportunities. And boy, they all look really good individually, right? But man, you put this all together, how does this make you feel? Like, oh dear, that looks, even to me, that looks like way too much chocolate. And I don't think I can actually handle all of these things. And what's going to happen? I'm going to have partially eaten chocolate, and I'm going to have things that are late. I won't be able to finish that piece of chocolate, and I'm going to be completely stressed out. I might actually start to hate chocolate. So that's a really big problem. And, if I'm late on things, people won't ask me to do anymore. And I don't, I really don't want to get sick of chocolate. So our goal is to get to a selective yes, where you pick the chocolates that are really the most exciting to you. You need a fair amount when you're starting your career, but you want to have a plate where you can actually finish the tasks, eat the chocolate, and enjoy it. So which would you prefer, the list or the picture version? A lot more fun doing pictures. If you're going to use text, and you will need to use some text, there's some guidelines. So one of the things you'll notice with this particular image is, where is the dog looking? And where is he going to send your focus? It's like off to the left side, but the text is actually to his right, or to my right. So it's kind of like the dog is looking in the wrong direction. So if you're using text, and you might be using it within the image, you might be using it outside the image, but you kind of want your subject facing the text. So we have the cute dog facing the text. And then your text and your words, text and words, boy, that's not quite right. Even after I rehearsed this 15 times, it should say text and pictures should give you a greater impact. So if you're going to use text along with your images, it should be to increase the impact. All right, so some things about slides when you're using text. So there are some things that are not so good. Like, this is not good. Many bullet points are not good, especially if they're in a small font. Small text. So you're giving a talk to a very large room, and you have a bunch of bullet points, and they're in really small text. Nobody is going to be able to read them beyond the first couple rows, and so you're going to lose your audience. Low color contrast. Put green on top of green, not so helpful. Fancy fonts, really difficult to read. Horrible background and text colors. Okay, I like red and green, but looking at this for an hour, oh dear, that would be unfortunate. And using long run-on sentences with lots of information that might be good, but means that you are reading this instead of listening to what I have to say, which is actually more important. And the last one says, even if you can't read it, it says, you get the point. So what does work for texting? So white on black, very clean, very neat. You want fonts without serif, so plain fonts, not fancy ones. Black on white works really well. Yellow on blue. And you're texting, now this is guideline, no more than 6 words. Because if you start going back and looking at my talk, you'll see that I've often used more than 6 words, but I try to limit it. And so just to make the point, no more than 6 words. A couple of other things to avoid. So where is your focus on this slide? You are looking everywhere, but at the middle, where I actually want you to be looking. So try to avoid distracting animations and transitions. It's great to use some animations, but if every slide has 10 different animations where they're, things are flipping in and rolling out and sliding up, it's going to be really distracting. And the same things with transitions. If every time you change the slide, you have some weird transition, it's going to be pretty distracting. So you want to minimize those distractions. Okay, so we have assembled our pie. There it is. It looks gorgeous, except that it's kind of unbaked. It's sort of raw. So now we're going to stick it in the oven. And so you can see that you need to actually make your lecture a little bit ahead of time. At least I do. I have to go through and practice and think about it. So while it's in the oven, you are going to be reviewing the literature to make sure that you can actually answer questions. You're going to be anticipating the questions that might come out of this, and you'll be dreaming of the pie. So you'll be dreaming about your lecture or pie, or in my case, chocolate chip cookies would probably be better. You are also going to practice your lecture. Now, I realize this sounds strange, but you actually, to do a really good talk, you have to practice it, especially if you're doing something that's mostly images, because you have to remember what you're talking about and how to make your points, even though you don't have a lot of text, which you're not going to be reading. And of course, you're going to be doing this with a timer so that you know how much time you have for the lecture and if you need to cut things out and all of that good stuff. You may consider having a coach. And actually, a number of the academic programs, I know the Society for the Council of Ultrasound Fellowships and CORD have programs that you can get formal coaching before you give a talk at any of the big conferences. So think about a coach. And, it might even just be your husband watching you or your wife watching you, or, you do this with a couple of colleagues before you give the big presentation. So think about coaching. You can videotape yourself. So this sounds really weird, but videotape yourself and you can see all the weird little things that you are doing, the bizarre facial expressions, the ums and ahs, like I just did there, that you're incorporating into your lecture. And there's a feature, if you're using PowerPoint, there's actually a feature in there where you can do coaching. So you click on this coaching button and then you deliver your lecture. And of course, I don't think you're on the camera, but they actually give you feedback. It's probably some AI function on your lecture, and you can get the feedback as you're doing it, or you can get the feedback at the end. So that's something to think about as well. But it never hurts to videotape. I did this coaching program through CORD, and part of it was that we had to be videotaped doing our lecture and then critique it with our coach. So it was really difficult, but it was very useful. And then you need to think about questions. What kind of questions might people ask? And how can I be prepared for them? So I know the literature well. I know the background. I may not be covering everything, but I have done due diligence to prepare for those questions. And then for this type of a lecture, if you're going to take the time to do it with pictures, and it's great for the lecture, and people generally remember it pretty well, but you actually probably want to make a handout which has some takeaway points on it. And, it might be virtual, that you have it as like outline of your slides or something like that where people can see it on a website. If you're in a small room, you might want to just hand out paper. You could actually do this through a QR code, but you may want to actually have the takeaway points on your on some sort of handout. In this case, because the lecture is taped, you can come back to it and actually revisit it. And then, very important these days is the tech check. So as you're thinking about this and talking to wherever you're presenting it, what kind of technology do they have? Do they only have a mic that you're going to have to stay on the stage, which is a problem for those of us who like to walk around? Or will you have a lavalier mic where you can walk around in the audience and still be able to advance your slides and make it really engaging? What kind of connection are you going to have? And I have a colleague who carries around a backpack that has like every different connection, carries his computer, he's got a thumb drive. And actually I do that too. I have it on my computer. I have it on a thumb drive. I email it to myself so that you have multiple ways of accessing the lecture, because you just never know what you're going to find. Now, of course, if it's at your home site, you're pretty well aware of that. But when you're asked to give a lecture somewhere else, you really want to make sure that the tech is going to your tech is going to work, and especially things like video clips. So you really want to be able to like send the lecture in advance, or at the bare minimum before you give it, you want to actually be able to go through your slides, make sure the video works, make sure that your orientation is correct. Do you have widescreen? Do you have regular screen? So I used to do a lecture for the Ohio ACEP board review course. And one of the things I asked for, because I used a lot of videos, which most of the lectures didn't, I asked to be after a break. So I would have 15, 20 minutes to make sure that all of my videos worked and that I fixed any problems that there were with the technology. So really, really important to do that. Okay, so we're now thinking about presenting the pie. We've done our homework. We've come up with our core concept. We have our objectives. We've figured out how they all get put together, and we've assembled the pie, and it's baked and it's out of the oven, and we're now going to present it. So presentation, you want to look the part. You are the presenter. And typically this means kind of one level of dress code above what the audience might be wearing. So if you're in Phoenix and everybody is in shorts and sandals, you probably want to be wearing maybe a pair of khakis, a shirt that's collared, but you probably don't need to be in a suit and tie. If everybody's in a suit and tie, you may need to be in a slightly fancier suit and tie. So you want to look the part, and you want to kind of whet people's appetite. So I've got this nice dish, and I'm going to talk about what their expectations are. And many times as you go through a lecture, there's always going to be a couple little glitches in it. So you're going to whet their appetite. Here's what we're going to talk about today. Here's what we're going to do. We're going to have apple pie. It's like double crust. It's got apples. It's actually got some raisins in there, lots of cinnamon and some nutmeg. And then if you want it, we'll put some whipped cream beside it. And then set the expectations. How is this going to work? Do you want everybody to hold their questions until the end? And some of this may have already been decided for you, but if it's not, then you want to make sure that you say, here's how this is going to run. I'm going to do 40 minutes of lecture, and there's going to be 10 minutes of Q&A, or please stop me during the lecture if you have a question. I have people who are going to go out in the audience with mics so that we have some time to do that, and I'll work on keeping us on track. But I want to make sure that we get all of the questions answered. So, and then don't read. So don't have a bunch of text, and don't stand there and read your slides. So, this type of lecture can be really difficult, especially if you're a little nervous like me about giving lectures. So some people like to use the note feature in PowerPoint. I can never get it to show up so when I'm actually giving the lecture. So if it's a lecture that I haven't given, that I don't have a lot of experience with, but I'm doing this format where I'm using a lot of imagery, I want to make sure I'm covering everything. So I actually will have some notes with me that I can refer to. Now, nothing that I'm going to read, but something that I can glance back at as I'm looking as I'm giving the lecture to make sure that I don't miss anything. And then giving the lecture. This is the expectations for questions how we're gonna take care of them, and I want to talk a little bit about questions themselves and what kind of questions and how you might want to deal with them. So some of the questions might be pretty basic and they kind of fit into where you're going with the lecture and you can answer them right away. Like, is there ice cream for my pie? Or can I do the fast with a curvilinear or a phased array probe? So those questions are kind of like, oh, yeah, I can answer that right away. And then someone will ask for can I have some, like, is there caramel for this? Can I put caramel on my ice cream and my pie? And you're sort of looking around, I made the pie, but the side stuff I'm not sure about. But you know what? I can find out. So let me get back to you on that. And you're going to do a quick check in the background and figure that out. Or it might be a question where it's like, I don't actually know, but it's a great question. So come up and give me your information, and I'll find an answer for you, answer to it for you. And then you might get some questions that are kind of out there, and somebody's asking you, can I have cheese on my pie? And you're like, I don't actually know how to answer that. Or they might be asking you about, can I use, what's the appropriate setting for what's my appropriate gain to take the best look at lungs? And you're like, I think there's a study out there somewhere, but I can't really remember. So if you're in a space where you have some other experts in the room, you might ask, hey, has anybody else ever heard of this kind of wacky idea of having cheese on your pie? Or, anybody have information on what settings I should use when I'm doing lung ultrasound as far as gain and power? And, you might actually find somebody who says, oh, yeah, there was a study done 2 years ago by somebody about doing that, and here's what they recommended. So somebody might say, oh, yeah, and, cheddar cheese on pie is actually the way to go. And I thought this was really weird, but my husband was like, oh, no, we always put cheese on our pie. So it's a thing. So ask an expert around you, or make sure you try and get back to the person. And you might get those questions that are completely off base. You're not even talking about them. Like somebody says, hey, how about if we make a chocolate chip cheesecake? Can I have a piece of that? And you're like, what? Chocolate chip cheesecake? That's what? We're not even talking about that today. So you need to say, that's actually a different topic. It's a great thing for a future lecture that you might want to look into, I might want to look into, or you might find another session that's comparable that will talk to you about making cheesecake chocolate chip pie. But that's really outside of the scope of what I'm talking about today. And of course, you're going to be looking at the time as you go along. So sometimes you'll be in a venue where they have this giant clock or a timer in front of you, and it's counting down in green. And when you get to the end of your time, it turns red. And so that will tell you, I'm done. I have to be done. Oh, dear. I didn't plan my time very well. But it may be that you don't have anything like that. So set a timer on your watch, or something that you can look at sort of continually to see where you're at. Like I have my iPhone right next to me, and I can see that I have lots of time, I'm actually doing really well. And then as far as the actual presentation, you want to be friendly. You want to be outgoing a little bit, but you don't want to be like a maniac. You want to modulate your speech. So, like, I tend to talk too fast, which you'll probably notice as you're going through this lecture, because I'm not sure I've done a great job of that. So just kind of think about that. And that's where coaching and doing your self video is really important, because you can kind of catch all of that stuff. And then you want to make sure that you wrap it up. So what we talked about today was making this apple pie and presenting it, or preparing your lecture and presenting it. So the core point, I did fix this in the last version. The core point of this talk is to make you, to allow you to use some tools to improve your lecture presentations, ultrasound or otherwise. And we talked about the necessity of having only a few objectives and how you're going to proportion those objectives so that your pie tastes good. If you have too much sugar in there, it won't be great. If you overdo the nutmeg, there's going to be a problem. And then how you want to put it together. What's the pie going to look like? Who's your audience? What's the venue? So how's the pie going to look? What do I need to focus on? And that's going to allow you to assemble the pie or make the recipe. And then there's a lot of work before you give the talk as far as preparation goes. So while that pie is in the oven, you're going to be doing some research. You're going to be making sure you can answer questions. You're going to be asking about the lecture format, like where am I going to be? Well, you've already talked about who's your audience. But so this is really the time that you're dreaming about the pie, and practice, practice, practice. And then you're going to present this really nice pie. So for the future, I'm hoping that now that you've watched how to make and present a pie, that you will think about it as you are working on your next lectures. And I hope that you will take a few bites. You don't have to do this all at once. Take a few bites, incorporate them into the lecture, and then you can start to use more of these ideas. And hopefully you will actually decide that this is really the way to go. It's more work, but the audience really enjoyed it. They actually got the core point and my objectives. So I'm going to eat the whole pie, eat the whole slice, eat it up. I'm going to go with it. There are some resources for pictures. There's some low-cost resources, and this is a combination of several folks' sources. There's some free pictures, and then there's also places you can get ultrasound images. Radiopedia is actually a pretty good place to go. You just need to provide credits. And then ultrasound images, your personal library. If you don't have an image, you can actually ask around. So ask your colleagues, has anybody had this particular case? I really need an ovarian torsion, or I need a tubo-ovarian abscess, or whatever. And then you can use journal articles. You can screen capture some images from there, again, being very careful to provide credit. There's a complete anatomy program. Matt uses this a lot. It's really, really excellent anatomy imaging, and that's really great. And then there's all kinds of books out there, and there's YouTube, and I particularly like the Gar Reynolds presentation Zen. It's a book, and then there's a whole series of videos and whatnot. But there's a lot online that you can use to finesse your lecture presentations and get some other ideas. I mean, you don't even have to use PowerPoint. There are other more advanced presentation forms that have come out, although I'm still not seeing a lot of them in use right now. So, questions? Comments from the peanut gallery. Was this helpful?
Well, thank you, Sandy. I found it really helpful. If for no other reason than it made me hungry for pie.
Oh man, I hope I did a little more than that.
No, this is good times. A lot of giving a lecture is a very complex and nuanced thing. And what I've learned over the course of my experience, and I don't claim to be an expert lecturer at all, I just have done it a lot.
Me too.
One of the things that
expert.
I've found is a good lecture can make, or a good presentation can make or break a lecture. You may have the best material in the world and just the worst presentation. Or you can have, a great presentation and it just hit it out of the park. And just the way that certain individuals with their voice and their intonation and their supporting material can just captivate an audience and convey that information is just magical from time to time. So hopefully this was as helpful for you as it was for all the rest of us in terms of how to just think through. And I think one of the big things is just putting that forethought into it. It's like, who's your audience? What's your venue going to be like? How do you present yourself? How do you actually say it? How do you make slides that reinforce and not distract? That's the big one from your presentation. So, Sandy, I thought that was spectacular, and I really appreciate you coming on again and giving your expertise for how to give a presentation.
Thanks, Matt. It was fun. Now I'm going to go have some pie.
Oh, yeah. Let's get some pie. So we're going to wrap things up here. A little bit different topic than normal. Something kind of fun, something lighthearted, something that will help you as you try to convey all the ultrasound information that you've been gaining through your own knowledge, your own research, your patient care experiences, through watching our YouTube channel, all those good things. Hopefully this will help you on your way. If I guess we can use that as a good segue just to remind you, we are putting this up on YouTube. Look forward to having you guys go over there and watch this lecture as well as all the previous lectures. While you're there, hit that subscribe button so we can know that you're a part of our community. Hit that notification bell so you can get notified of all of these different lectures that we give. I was looking at our stats the other day, and only a small fraction of the people who watch our channel subscribe. And this is not atypical. A lot of channels that I watch describe the same phenomenon. But don't let that be said of you. As you're watching this, scroll down there, hit that subscribe button, and then you can have it on your feed to see all the content that we're putting out to make you not just a good doc, but a great doc. And not just a good lecturer, but a great lecturer. So with that said, we're going to wrap things up here. We have 2 more weeks in our academic year. Next week, I had totally forgotten this one as I'd been announcing things, but I'm really excited nonetheless. One of my good friends, one of my colleagues from a different institution is going to be presenting to us a little bit more about the transesophageal echo. Pretty excited for that. And then I'll conclude the year in 2 weeks with my digital tools for success in academic medicine presentation. I'm really excited about this one. You guys should be too. And we'll take a break for the summer and then start the whole thing again in the fall with a whole bunch of great new materials. So that being said, we'll wrap it here. Thanks for joining. Thanks for being a part of this community and this group and this forum and the venue and everything you want to call it. We will see you next week, same time, same place. Have a good week. Bye.